You please call the roll of board members.
Yes, Chairman. I'll begin with Anthony Williamson,
Here.
David Cruz,
Here.
Cynthia Rucker,
Here.
Nelva Lee,
Present.
thank you. Shane Mobley,
Here.
Norman Boyd,
Here.
Dr. Coles,
Here.
and Roger Folsom.
Here.
Chairman, that concludes my roll call.
Thank you, Denisha, and thanks to the board members for joining this morning. We have a quorum to conduct business. We have all the board members on the phone and appreciate your joining us this morning. Welcome to our first meeting of the new year. We have somewhat of a brief agenda this morning, but we do have two items that the department will be asking us to vote on. One of those for final adoption, and one of those will be a revised timing on a previously approved item. So we'll move right into the agenda. And the first thing up is the minutes of the December 14, 2023 meeting. And I'll ask if Dr. Cynthia Ruckers had a chance as our secretary to review those minutes and would recommend approval.
Good morning, Chairman Board. I have reviewed the minutes from the December 14th board meeting, and I do find them to be in order, and I do recommend they be approved as they stand.
Thank you. It has been recommended that the minutes of the previous meeting be approved. Is there a second to that?
Nelva Lee seconds.
Nelva Lee has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved. Thank you very much. In my opening comments today, it is a pleasure to announce that, or not announce for the first time because it has been made public by the governor's office, that our previous board member, Russell Crutchfield, Dr. Russell Crutchfield, has been appointed Chief Operating Officer on the Governor Kemp's staff. Quite a nice promotion for Russell, and we congratulate him on that and appreciate his service here to this board as vice chairman over the last few years, and wish Russell the very best in a very big responsibility assignment that he's taking on at the governor's office. Then the second item there is a replacement for Russell on our board has been announced. And I don't believe he has time to join us today, but will be joining our board. It's Dr. Charles Thomas Hopkins, who is an orthopedic surgeon in Griffin, Georgia, yet affiliated with Wellstar Hospital in Griffin. So we'll welcome him to the next meeting, I'm sure, next board meeting as he joins with, and that will give us the full complement of a 9-member board. With that, those announcements, I'll move to the next item. We had Anthony Williamson's Care Management Committee met this morning, I believe, and we'll get a report from Anthony.
Thank you, Chairman Boyd. Yes, we did have the opportunity to meet this morning, and it was a rather full information.
I think we're having a little hard time hearing in here. Is there somewhere the volumes can be turned up, or?
Can you hear me better now?
Yes. Thank you.
I'm going to speak a little louder. But we did have the opportunity to meet this morning. We heard from Mr. Chet Basine, who is the executive director of the Georgia Board of Healthcare Workforce. He shared with us a website with a lot of physician workforce data where you are able to look up number of physicians by county and by specialty. We then moved on to reports from our CMO physician leaders with a focus on healthcare access. Some of the information that was shared was that rural counties, as you would imagine, have a higher incidence of disease where access is more challenging. There are 9 counties in Georgia that have no physicians at all. And each of the CMO leaders went through a list of strategies that they are implementing to try to address access. Some of those strategies include student loan payback for new graduating physicians to encourage them to work in rural areas in exchange for reimbursement on their loans. Other strategies include clinics at local schools, so school-based clinics, grants for allied health providers, for nurses, behavioral health counselors, social workers, and the like. And then some other innovative strategies where we're seeing some partnering with industry, including telehealth, mobile clinics, remote patient monitoring, care in the home, et cetera. And that was essentially the bulk of our meeting, hearing from each of the CMOs, and we concluded after that. Thank you.
Are there any questions, comments from the board for Mr. Williamson, please? Hearing none, thank you, Anthony, for that report. And we'll move to the next item on the agenda, which is the commissioner's report, and I'll turn it over to Commissioner Carlson.
All right, thank you, Mr. Chairman. Good morning, members of the board and all of you joining us online today. It's great to be with you. As you all know, the 2024 legislative session is well underway. As was the case last year, in the very first week, the General Assembly was able to agree and pass a calendar for the entirety of the 40 legislative day session. So per the adjournment resolution, HR 779, crossover day will land on Thursday, February 29th, and sine die, day 40, will take place on Thursday, March 28th. It's great to have the predictability of a full calendar for planning purposes, both personally and professionally. But as we all know, while it's wonderful news to get out before Easter, this schedule calls for an aggressive calendar, which in turn will call for our department to be nimble, flexible, and efficient, to be responsible to requests on short notice with tight deadlines. It's always our intent to remain a responsible and reliable resource to the governor's office, OPB, and the legislature throughout these deliberations. And I want to thank our DCH team in advance for what I'm sure will be a few long nights and early mornings. And we'll all hopefully relax after Easter. Last week, Governor Kemp released his amended 2024 and fiscal year 2025 budgets in conjunction with the State of the State address. I want to thank Governor Kemp, OPB Director Rick Dunn, and the OPB staff for their support of this agency and their recommendations. Specifically, I want to thank them for their approval of 20 new positions for our proposed CMO performance management project and the salary increases proposed for our HFRD surveyors across the state. Both of these proposals were approved by this board in August, and we are grateful for OPB's continued support of these efforts and look forward to working with the appropriations committees and the legislature to see these items through. Additionally, I want to thank the governor and OPB for their funding towards the now and comp rate studies, which are integral to stabilizing the provider networks across the state, whose services are so vital to thousands of families here in Georgia. Another item approved by this very board. And I know it's also an item of great import to Commissioner Tanner and his team at DBHED as we work closely alongside one another throughout budget preparations this fall. The governor and OPB also took great strides to strengthen our SHBP team, our state health benefit plan, by devoting much needed funds to bring future projections of revenues and expenses into alignment. This support is vital to Director Amos and his team as our entire country tries to navigate the realities of higher healthcare costs and inflation. Lastly, DCH and state employees as a whole should be so very grateful for the governor's commitment to this state workforce. Between the $1,000 stipend just this December and the proposed cost of living adjustments across all agencies, it's clear this administration values the sacrifices and selfless public service demonstrated in these halls every day. As I've said in many a staff meeting, I simply don't know how this team gets all these projects done in any given day, but you do. In the last week alone, I have personally witnessed one staff member reach outside Medicaid and DCH to find coverage for a family just hit with a daunting and unexpected cancer diagnosis, while only days earlier, another member of our team secured a much-needed waiver renewal so their daughter could move forward with her own treatment. Meanwhile, SHBP helped a lifelong educator and her family navigate her new retirement. The truth is, these things happen every day. So please know your efforts do not go unnoticed. As is often the case with a servant-minded person, they rarely seek out a thank you. So I'm taking it upon myself to do so today. And speaking of thank yous, Mr. Chairman, how's this for a segue? Speaking of thank yous for Mr. Chairman, I'd like to take a moment to thank some of those DCH team members celebrating a milestone today. Lisa Davies with our 1-year anniversaries first. Lisa Davies, HFRD. Andre Jeffries, HR. Taylor Ramakran, MAP. Rachel Cox, HFRD. Irina Koznikov, HFRD. Jody Ray Lund, HFRD. James Hickson, HFRD. Shaquia Henry, MAP. Janice Kaplan, HFRD. Dorothy Houston, Financial Management. Talitha Barnett, MAP. And LaPrisha Cody with SHBP. For our 5-year milestones, Peggy Johnson, MAP. Mark Meadows, IT. And for our 10-year, Kimberly Captain with Georgia Drugs and Narcotics. Erika Coates, IT. Helen Garnicia, HFRD. And Patricia Garcia, celebrating 15 years in MAP. So I really want to honor those guys and thank them for being with their team, and congratulations to our 1-year milestones. And with that, Mr. Chairman, I'll hand it off to the agenda.
Thank you, Commissioner, for your report. Are there any comments or questions for the Commissioner from the board, please? Hearing none, I thank you for giving us that report, and particularly for recognizing the accomplishments for individual situations that your people have done to help better the lives of people that find themselves in need. Thank you very much for that. Of course. We will now move into the agenda items where we'll be asked to consider for a vote. And I'll turn it over to Brian Dowd, Deputy Executive Director of Policy and Compliance.
Thank you,
Brian,
Mr. Chairman. Commissioners and members of the board. At the December board meeting, Lynette Rhodes presented for initial adoption consideration of an amendment to the existing 1115 demonstration waiver, Planning for Healthy Babies. The amendment would make permanent a provision initially enacted during the public health emergency that allowed legally responsible parents and caregivers to be reimbursed to provide personal support services within the Georgia Pediatric Program. DCH seeks to continue this allowance in order to ensure delivery of care to Georgia's GAP population while helping to address the provider workforce shortage issues. It is important to note that legally responsible parents and caregivers are under the same requirements that other direct service caregivers must meet. The requested amendment is limited to personal support services and does not include the provision of skilled nursing services. An opportunity for public comment was held on December 18th, 2023 at 1 p.m. and at December 21st, 2023 at 11:30 a.m. We have to do 2 for an 1115 waiver, so it's a little different. Written comments were due on or before January 16th, 2024, just a couple of days ago. We received no oral comments as part of the public hearings. However, we received 50 written comments in response to the proposed change. All the commenters were in full support of the proposed amendment and noted that adopting this authority serves as a lifeline to many families. Additionally, commenters expressed their interest in ongoing dialogue to ensure the use of Georgia with medical challenges and behavioral health challenges are visible and remain a vital part of what makes Georgia a beautiful place to live. The department thanks the commenters for their written comments and the support of this proposed amendment. I'd be happy to answer any questions you may have at this time and would respectfully request final adoption of the amendment to the 1115 Planning for Healthy Babies demonstration waiver.
Any questions, comments from the board, please? We all appreciate the work that you did in the background and providing us the information, including all of the written comments that we had a chance to review, and you summarized, and I appreciate you doing that in that manner. If there are no comments or questions, is there an motion for approval for final adoption?
Roger Folsom move for final adoption,
Roger
Mr.
Folsom
Chairman.
has moved for final adoption. Is there a second?
Second, Dr. Coles.
Dr. Coles has seconded that. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much, and you may proceed with your next item.
Thank you, sir. At the October DCH board meeting, the board granted approval to move forward with a submission of a state plan amendment, increasing the rates at psychiatric residential treatment facilities for children. Subsequent to that board approval, Okay. Shocking.
Okay, Brian, before we lose it again, if I can, hopefully got everybody back online, if I could kind of short circuit this, as I understand what you're saying, the only thing we're doing here is that because we're required by CMS to change the effective date, and so we're voting on that change of effective date, is that correct?
We're not even asking you to vote because it's not a change in rates or
Okay.
rate methodology. We're literally just for
Okay,
transparency,
so-
letting the board know. So there's no action that's even needed on your part,
Okay.
and you perfectly summarized what it is. It's just a change in effective date.
Thank you very much.
Yeah.
With that, we have completed the agenda items that we needed, and we thank you all for participating today and bearing with us for the interruption, and apologize for that. Does anyone know of any new business that needs to come before the board at this time? Hearing none, again, Happy New Year to all of you, and our next meeting will be on February the 8th. Thank you so much for your participation. Goodbye.
Thank you.
You had to vote on that. I